Hi, I'm Dr. Peter Osborne, founder of Gluten Free Society, and I'm here in the manufacturing plant where all my products are made. I wanted to give you a behind-the-scenes tour to show you how we make my products so you can be as confident as I am that they are safe, powerful, and effective. In step one, when a raw material ingredient arrives at the facility, we first need to make sure it really is what our supplier says it is. For instance, if we ordered magnesium, we test to verify that that's what they shipped. Then we further test to ensure it has zero issues with harmful bacteria or heavy metal levels. Why do we do this? I want proof from the start that you're getting clean, safe ingredients. This step exceeds industry standards, but I wouldn't have it any other way. Then comes step two. Once all the raw materials pass this first step of quality control, they're weighed individually so the right ingredients and the right amounts end up in your supplements. They're blended in specialized machinery to make sure you get the same product each and every time. During step three, the product is packaged and goes to the lab for its final round of testing. In this stage, we confirm that what's on the label is in the product and retest to ensure nothing unexpected has snuck in. Testing before, during, and after might seem redundant to you, but we want to be absolutely certain you can trust these products. By the way, if you get your supplements somewhere else, there's a chance they may not have been tested at all. I use these products in my clinic, I use them myself, I use them with my friends and family and loved ones, and most importantly, I share them with you, knowing you'll see powerful results in your own health. And as always, we want to make sure you have access to high quality, gluten-free products so that when you're looking for supplements to take, you don't have to worry about cross-contamination issues that could make you sick. Hey everybody, welcome to Pick Dr. Osborne's Brain. We've got a great show for you today. If you're new to the show, it's all about your questions. Type those into the feed now. I'll do as much as I can to answer as many as I can here in the next hour or so. If you missed Tuesday's class, we talked about biological dentistry, things like root canals, silver amalgams and fillings. It was an interview with Dr. Krupa George. I think it was a really good interview, and I think a lot of you could take a lot away from that. So if you missed it, go back and check that out. Okay, let's dive in to your questions. Let's see here. Can a vertical cracked tooth be repaired? I'm not a dentist, so that really would be a better question for a dentist specifically. I would imagine it depends on the nature of the crack and the depth and the severity of it. But certainly I would probably not be the best person to answer that question. How often do you find problems with the ingredients you purchase for use in manufacturing products? Very rarely. Partly because we've been doing it so long. So there's like a phase initially where you're testing different companies and you're bringing in different products to the warehouse. You're getting those products analytically tested for things like bacteria and metals and other toxic excipients, or even just being tested for the actual ingredient itself. Does it contain what it says it contains? And so that initially finding the right vendors who are honest, there's kind of a period where you send a lot of stuff back, and then you start finding some of the more reputable vendors who do a great job. So it's very rare nowadays, but earlier on, you know, it wasn't uncommon to find product that we'd have to send back. We still get some things every once in a while that for whatever reason don't pass our in-house muster, and we send those back and move forward. Let's see here. What do the studies show about the toxicity of fluoride? Lots. Probably the best place to go and read more about fluoride toxicity is through an organization called the Fluoride Action Network. So I would encourage any of you who want to read more, learn more about what the real research says on fluoride, is check that group out. What's the difference between a biologic and holistic dentist? I'd imagine they're pretty much the same. I think the terms are relatively synonymous. However, there is an organization that I like who trains dentists to think along these lines. That organization is called IAOMT.org. And so if you go to that website, IAOMT.org, you can type in your zip code, do a search, and you can find dentists in your area who've actually done postgraduate training. And of course, with postgraduate training, you want some type of, I guess, controlled credentialing process so that you can guarantee at least that the dentist that you're working with has some minimum amount of knowledge. Now, I say minimum amount of knowledge, not because you're looking for the guy that has minimum knowledge, but at a very minimal level, meaning that they at least know these things. They probably know a lot more based on their experience and based on additional things they've done. But we train for a minimum adequacy. And so organizations like IAOMT help ensure that. Hi, Dr. Osborne. I did a surgical extraction on my wisdom tooth on Monday. What aftercare would you suggest for healing? A few things. One, we do have a post-surgical protocol. We'll put a link up for you. It's pretty lengthy, but those nutrients are top tier as far as my recommendation is concerned. And there's a lot of them there. But anytime it comes to surgery, there's a lot of healing that has to happen post-surgically. And depending on the depth of the extraction, how easy the teeth came out, how much cutting had to happen, you may need more, you may need less. But I would, at the very minimum, I'd be on 5 grams of vitamin C. I definitely would be taking extra L-glutamine, anywhere from 2 to 5 grams a day. I would also be on omega-3, 2 to 3 grams a day, and ultra nutrients, which is our multivitamin. As a bare minimum for full-on nutritional support, I'd be on that 4 capsules a day after any kind of surgery. Let's see here. How often do you, let's see, how to combat GERD. You got to figure out what's driving it. GERD, gastroesophageal reflux disease, can be, gluten is one of the biggest probably dietary causes that we see. I've seen sugar trigger it. I've seen dairy trigger it. I've seen different bacteria trigger it, like Helicobacter, H. pylori. Yeast overgrowth in the stomach can trigger GERD. Zinc deficiency can trigger GERD. So there's a lot of potential reasons why. So when you say, how do you combat it, figure out why you have it. And that can be done specifically through testing. Outside of that, I would probably look at not for a long-term solution, but maybe for a short-term symptomatic support. I would look at, we have a product called GI Soothe, which is a number of mucilaginous agents like aloe vera and licorice and marshmallow. And these things will coat the lining of the stomach. And so they can help in terms of supporting symptoms, but they're not going to fix the problem either. So for short-term symptomatic relief, something like that, but for long-term, figure out what's driving it. Is it a good idea to rinse the mouth with a couple of drops of 5% Lugol's iodine with warm salt water? I mean, there's no problem in it. Do you have a specific reason why you're wanting to rinse your mouth like that? I mean, as a general rule of thumb, I don't recommend people need to rinse their mouth with things that have antibiotic properties on a daily basis, because your mouth has a microbiome and it's an important part of your health as well. But if you had like a suspected tooth infection or a cut or something inside the mouth, that's not a bad idea as an aid. Please reassure us that drilling your mouth bone for an implant is okay. What are the risks? If no obvious infection with old implant or root canal, is it worth the risk? I think it's an individualized question. I mean, honestly, there's not a one size fits all with this kind of thing. You should always take any kind of surgery seriously and always understand what the potential risks are. And risks aren't generic either, because part of what are your risks boil down to what else is going on in your medical history. For example, let's say you're diabetic. There's a different set of risks associated with diabetics having surgery than with somebody who's generally healthy. With diabetes, you're more prone to infection. Generally, if you're a diabetic, you're probably on multiple medications. For example, let's just use metformin. As a medication, metformin inhibits CoQ10 and blocks and causes vitamin B12 and folate deficiency. Those deficiencies create healing risk post-surgically. You don't heal as well without B vitamins. You don't heal as well without CoQ10. Your gum tissue, your collagen requires CoQ10 for its formation. So those are inherent to, say, somebody who's on metformin, or maybe you've got high blood pressure and you're taking a diuretic. Well, diuretics deplete calcium and magnesium and potassium and deplete vitamin B1 and CoQ10. So, you can see that risks are based on medical history. I've given you a couple of just unique different examples. If we're talking about generalized risks of an implant, one of the risks is always going to be an infection, because when they're drilling into you, that you run the risk of that as a potential complication. There's a complication risk with interaction with the medicines they may be using for pain, like especially if they're putting you out or putting you under. So some of the pain medications you may have unique risk about. So talk to your dentist about that. There's also potential risk in terms of error. It's very possible. I mean, dentists are humans; they make mistakes. Everyone does. But they could drill too deeply and hit a sinus pocket, and they could hit a nerve and damage a nerve and cause you to have numbness. I mean, that question is not answered best by me in a video generalizing. That question is best answered having a conversation, a meaningful conversation with your doctor, with your dentist, because again, he'll have your history better than I will. It should be able to elaborate more in depth about the potentials there. But I'm not opposed to an implant at all. I think implants can be a fantastic alternative to not having the tooth at all. And there are cases where teeth die. I mean, I've seen a number of patients where they've had traumatic falls, hit the tooth, broke and killed the tooth. An implant was their best solution, and barring not having a tooth in that location and creating the risk for deterioration of the opposition tooth, an implant can be a great option. I think part of it too, I would encourage any of you visiting a dentist to also inquire about getting tested for dental material reactions. So a lot of biological or holistic dentists will actually do a test measuring for whether or not you're having a reaction to particular types of materials they might want to use in the implant or in the actual tooth replacement itself. And so being able to be tested for those materials to ensure that you're not reacting to them before they implant them into your body indefinitely is also a smart part of the protocol that can diminish potential risk. Great question. Using ox bile and digestive enzymes, but having severe pain in my gallbladder. They want to remove it soon. I'm conflicted. Been in the ER twice in a month. Scans are good with one stable stone. Work with a functional doctor and consider doing a gall flush. If you've got a stone in there, that could be part of it. But I mean, the other issue is you might be deficient in taurine or glycine or vitamin C or magnesium, all of which are required to appropriately produce bile. So if you've had the scans and your liver and gallbladder look healthy on the scans, in my opinion, removing it would most likely be a mistake. Again, without a more detailed history, that's just my own external speculation. I've very rarely met somebody with a gallbladder problem that couldn't be resolved nutritionally that required surgery. But you know, going it alone without guidance and help would be, in my opinion, not the best way to go. So I'd get with a good functional doctor and work with them to try to get to some resolution. Last dental exam and x-ray showed a root canal infection from old root canal after a bad car accident from 25 years ago. Specialist isn't available for retreatment for a few weeks. What are some care tips? If it's not an acute infection that is threatening your life, you know, you can gargle with silver, you can gargle with peroxide, you know, food grade peroxide. You can do some coconut oil pulling, all as potential options. Some people apply topically to the area, you know, tea tree oil, which has antimicrobial properties. So those are all some just kind of general natural things that you could do. You could also get with your dentist and see if he's got any other options in his natural toolbox that he has great experience with working with. If E. coli is suspected, what testing is recommended? That's a very general question, Tracy. When you say E. coli, do you have food poisoning? Are you talking about potential for food poisoning? So E. coli in the GI tract overgrowing, or somewhere else in the body? I'm going to assume you mean the gut. You can get a gut culture done. You know, any doctor can do it. It's just a matter of will they? And then from the culture, they can do what's called a sensitivity test. And the sensitivity aspect of the test measures whether or not, or what will kill the E. coli if it is indeed there. So it basically, the sensitivity aspect of the test takes the E. coli that they find and it subjects it to different types of antibiotics or natural agents to try to determine what's the best process in killing what you have. So the supplemental protocol, in my opinion, needs to be based on a culture sensitivity type of test. Now, there certainly are broad spectrum formulas that have antimicrobial properties. I have several of them in our shop at Gluten Free Society. Microbial Balance, caprylic acid. We have a product called Yeast Shield that all contain different herbs and plant-based compounds that have known antimicrobial, antibacterial, antifungal properties. But if you're trying to be super specific, it's best to get testing done. I bought Gluten Free Society vitamin C and have had it for about 2 years. It's expired, but I've noticed it's clumped. Can I still use it? Possibly. The biggest thing you want to look at, Gina, is this clumping can occur just because if you've opened the bottle and it clumped, that can occur as a result of some air exposure. But you want to make sure that the powder, the crystalline powder, is still white in color. If it's starting to turn a dark brown, that means it's oxidized. That means it's too old. When air hits it over a prolonged period of time, vitamin C oxidizes. That's why when we produce our vitamin C, we actually do so under what's called a nitrogen blanket. A nitrogen blanket is just a gas blanket that preserves the vitamin C and prevents it from oxidizing until we can seal the bottle. So in your case, if it's still white in color and it's just a little clumped, it's probably moisture that's in the bottle more than anything else. It should be okay. It should be okay, but because it's expired, you know, without actually having the bottle formally tested, it's, you know, I have to be cautious in what I can tell you there as well. But me personally, if I had a bottle of my vitamin C in my pantry that was 2 years older, or if it was past expiration date, if the powder was still white, I would probably still use it. But again, take that for what you will. Remedies for ear pain depends on what's causing it. If you have an ear infection, you know, you need to address that. If you have neurological type of ear pain, there's a number of reasons why that could happen. damage to the nerve itself. I mean, B vitamin deficiencies can drive neurological ear pain. Infection, fungal, bacterial infection can drive ear pain. Fluid retention in the membrane can drive ear pain. Neck subluxation, so subluxation in these vertebrae in your neck can reduce nerve flow to the ear and contribute to ear pain. So, I mean, it just depends on what it is. Could a root canal infection be causing bad sinus issues, tinnitus, chronic fatigue, and brain fog? It could be. Absolutely. It's a possibility. An infection in a root canal infected tooth can create a systemic inflammatory problem. It doesn't even have to be just localized to the ear or to the head, the sinus cavity. It can go systemic and cause a lot of problems. So it's worth looking into. I'm 68, working on healing from celiac disease. Is it okay to stop or pause omega-3 fish oil? I mean, yes. Especially if you incorporate, wild-caught fish into your diet or good healthy sources of omega-3 into your diet. Supplementation can be beneficial, but food is also beneficial if you're eating the right kinds, Maggie. So I would consider that as well. You might also get tested. I mean, ultimately, the answer to the question of should I take something or should I stop something is what's your need? Does your body have a need for more? Is your body low or lacking in a particular nutrient? And so INA testing can be very helpful to determine, what your needs are. If you're not familiar with INA testing, it stands for intracellular nutrition analysis. We do that kind of testing at Gluten Free Society. If you go to the website, we can put a link up for you, but if you go to the website, there's a lab testing option at the top of the site. And we offer several different kinds of lab for people who are looking to improve their nutrition, beyond gluten and autoimmune disease. So INA testing is one of those things. Let's see. Is it normal? Let's say I answered that one. Is it normal that celiac people that don't eat grains could not gain weight? Although take off supplements and eat organic food, cook at home, train 4 to 5 times a week. No, it's not normal. You're probably under eating. I mean, if you're trying to gain weight specifically, it's probably a matter of you're not eating enough, unless you have kind of a residual intestinal atrophy that's still there, a villus atrophy that hasn't yet fully recouped. I don't know how long you've been, gluten grain free. But in terms of healing and repair, it can take, approximately 18 months or so, post-diagnosis, post-diet change to really fully repair the GI tract. So, there's a lot of ifs, ands, buts in that question that you have. I would say my first question that I'd want to answer if you were in my practice would be, do you have persistent gastrointestinal inflammation that could be contributing to malabsorption beyond gluten? So like if you're grain-free, are there other foods that are triggering an inflammation in your gut? Do you have microbes in your gut that are driving inflammation, causing malabsorption that's persisting beyond the diet change? Because in my experience, those are probably the two most common things that we see. If somebody's doing everything well and eating enough food, it can be a malabsorption issue, and that should be ruled out if you're really struggling. But if you haven't started with just a calorie count, like get a BMR on yourself. BMR stands for basic metabolic rate. There are BMR calculators online. You just type in BMR calculator, go put in your age, your height, your weight, your gender, and it'll give you a rough approximation of how many calories a day you should be consuming. And if you're not close to that mark, if you're under that mark, you're not going to gain weight. And if you're at that mark or above that mark and you're not gaining weight, now we start thinking about malabsorption. Do you think it's possible to reverse or heal a tooth infection that needs extraction? It's hard to answer that question, Caroline, because the dentist who told you that tooth needs an extraction has an advantage over me in that he's been in your mouth, looked at your x-rays, looked at your infection, has a kind of a general maybe understanding of how severe or bad it is, and then has an experience with levels of infection that that he's basing that determination off of. And so, of course, if that's what you've been told, that's an opinion. That's a dental medical opinion. And you're always, welcome to get more than one opinion if you're trying to preserve the tooth. But it's hard to answer that question. Is it possible that an infection can go away in the mouth? Yeah, it is possible, but all those other variable factors will play into that advice. I think a lot of times if the infection is severe enough, bad enough, it's deep enough in the tooth, or the tooth is corroded severely enough that the dentist feels like it can't be saved, then he's probably right, and he's probably just going to save you a lot of time and grief and trying to treat it another way. But I also would say, if that's a conventional dentist, you might consider a holistic or biological dentist and see if they have other treatment options. Because I have seen some people where they had a different types of treatment options at a biological dentist's office, like peroxide treatments over the tooth, or ozone treatments over the tooth to kill the infection, and the tooth could be preserved. But again, lots of variables in regards to an answer there. Let's see here. Are eggs with omega-3s a good source of both EPA and DHA? Depends on what they're feeding the chicken, because eggs with omega-3, generally because they feed the chicken a flax, and that's going to be more of your EPA than it is DHA. Omega-3 triggers gives me a migraine and a headache. Do you think MSM would help instead? So every time, are you saying that when you take omega-3 supplements that you get a headache? I think that's what you're saying. If that's the case, it may be an ingredient in the omega-3, Carolina. So, one of the more common ingredients in omegas are lemon. A lot of them are infused with lemon to reduce any kind of burping sensation that might occur. And in that regard, I've had people in my practice that were allergic or sensitive to lemon, where we have a lemon-free option that we would give them. And then again, some people are allergic to the different types of fish that that the oils are extracted from, and that's not uncommon. Fish is a common allergen, and so if you have a fish allergy, that may be the reason why you're reacting in that way. But I don't know if I answered your question. As far as MSM, I don't know what you mean by that. Would MSM help instead? MSM can be helpful for headaches, but if the omega-3 supplement is causing your headache, then just discontinue the supplement. Don't necessarily keep taking the supplement, but then pile on MSM to try to reduce the side effect of the supplement. And this is true with any supplement. If your body rejects a supplement, listen to your body. Don't try to hammer away and suffer through it. Your body's trying to communicate to you, and usually your body's right. Would you recommend mouthwash for periodontal issues or some other approach? Mouthwash is full of garbage. It's full of, most mouthwashes are alcohol-based. The ones that aren't alcohol-based are antimicrobial based. So you're basically taking a lukewarm antibiotic and just, wiping out the bacterial colonization of your mouth. It's a bad idea. It's a bad approach. If you've got bad breath or something, and it contributes to maybe a temporary reduction of that, but at what cost? To the cost of the microbiome in the mouth. So I'm not a fan of mouthwash. As a general rule of thumb, if you've got periodontal issues, you got to understand why you have them. If you've got gum deterioration and gum bleeding, you've got to look at nutrition first. Are you eating something that's an irritant to your gum tissue or to your oral cavity tissue that's driving imbalances and driving decay and driving reduction of collagen formation around your toothpaste? You also have to look at things like copper and vitamin C and vitamin K and calcium and magnesium and the amino acids and proteins like glycine, because they play a role in the formation of the collagen that builds your gum line. And so if you're malnourished, and where we see a lot of people developing periodontal disease and malnourishment is from malnourishment to protein as a whole. They're not eating enough total protein in their diet. And then extraneously, where we'll see a lot of periodontal disease, because it's very popular right now, a lot of people are using nicotine. There are a lot of doctors online promoting the use of nicotine, for cognition and other reasons. And I don't recommend it, but they're using nicotine patches, and nicotine patches do cause periodontal problems. And so if that may also be an issue. I don't know if that's something that you're doing, but also something to consider. What nutrient deficiencies cause dry skin and dry hair? Several. So number one, we've got omega-3 fatty acids. Number two, vitamin E. Number three, and arguably one of the more common ones, is biotin. Biotin is vitamin B7, sometimes referred to as vitamin B8, but it regulates the moisturization of skin and hair both. So those would be the top three I would look at first, as probably the more common and most likely things that are driving dry skin and dry hair. Is nutrigenomics a good direction to pursue? Should each person undergo a genetic analysis once in life? Depends. I used to do a lot of nutrigenomic testing, honestly, and this was 20 years ago. I mean, we did this. I was one of the first doctors in the world to offer nutrigenomic testing to patients in a clinical setting. And actually partnered with a genetics lab in Colorado to bring that type of testing directly to patients. We collected data on nutrigenomic testing for about 5 years. And the core thing that kept coming up with that testing was, if you knew something about the person's genetics, like if you knew they had MTHFR or COMT or glutathione issues around their genes, supplementing them with more B vitamins or magnesium or glutathione or whatever it was, right, wasn't the answer. I'll put it like that, meaning that, clinically speaking, on paper, nutrigenomics sounds awesome, right? But in reality, as it plays out in a clinical setting, it's more complex than that. Because when you think about nutrigenomic testing, I mean, there are thousands and thousands of genes in humans. Most nutrigenomic tests are limited to maybe a few hundred. They're capped at a few hundred genes at most. And that's just human genes. And you have mitochondrial DNA as well, which is a separate set of genetics that you inherit from your mother. And then you have the bacterial genome, and you have the mycological genome, which is the bacteria and the yeast that live inside of you naturally have a genome as well. So when you're doing a test that measures, a handful of genes related to nutrition out of all the potential genes that can be measured, which is, thousands and thousands and thousands of genes, what data do you really have? I think a lot of practitioners, and I was guilty of this, try to extrapolate from that minimum quantity. And sometimes it's helpful, but usually it's not. So I would say, if you're looking to spend your money on something that could improve your health and give you knowledge about improving your health, genomic testing would not be the first thing on my list. Where I do today in my practice, where I do genomic testing, is when we have already done what I would call fundamental testing. And there's 4 fundamental things that everyone should be tested for if they're struggling with chronic inflammation or autoimmunity. Number 1 would be measuring for food reactivity. Number 2, chemical reactivity, chemicals from the environment or from products that you're using. Number 3 would be microbial imbalances. And number 4 would be nutritional deficiencies. So once those things are ruled in and out and those things are applied, now if a person is still struggling or there's still something not quite right, now we can start looking at genomics to see if there is a genetic variation that would play or is playing a bigger role than what might be typical. But usually genes don't create the problem. It's very, very rare. Environment creates the problem. Choices create the problem. And that, for all of you listening, should be empowering, meaning you're not doomed. You don't have terrible genes. Your genes are a gift from the Lord. And they're a blessing. They're not the curse. So don't ever let a doctor tell you you have bad genes, or because you have a family history of X, Y, or Z disease, that you're somehow doomed to the same fate of the people who are doing it wrong. Because if we go back in time long enough, modern diseases of inflammation didn't exist. I mean, you didn't have all the heart disease and autoimmune disease even as little as 120 years ago that we do today. So why? What's changed? Not our genetics. Our genetics have been the same. They haven't really changed or varied very much. But what's changed is our exposures. We're exposed to more chemicals today. We're exposed to food that's not really food, that has tons of chemicals and is grown with tons of chemicals and is stored improperly and prone to growing mold and other bacterial microorganisms. We've got, all kinds of medical guidelines and guidance that expose people to things that could potentially long-term create increased risk for problems. We've got just a host of variable changes in our environments today of things that we're exposed to that we weren't exposed to historically to anywhere near the degree we are. And when you have gene variances, nutrigenomic gene variances, those things can put you at risk if you don't change your environment. But typically, if you change your environment, the risk is relatively mitigated and your genes become an irrelevant conversation. So I hope that's helpful for you, because a lot of people search to blame their genetics. I think in a sense, it's kind of a naivety. We seek to blame something that's beyond our control so that we can relax about trying to control it. But in reality, if your health is poor, it's not the fault of your genetics as much as it probably is something in the choices that you're making or in the environment that you're in that you're not aware of, and that's where your focus should be. Is there something that can help me raising my white blood cell count? This is April on TikTok. I've been to a hematologist and had detailed lab work done with no sign of cancer or leukemia, and the only issue I'm still having is a slightly lower than normal white blood count. It's been going on for several months, and I have not been ill or had any symptoms that I'm aware of. So it may not be something you need to really worry about. So some lab reference ranges are different than others. So like if we're looking at white counts, if you look at LabCorp versus Quest versus other independent labs, they may have deviating lab reference ranges because they do change. If yours is kind of hovering on the bottom end or just a little bit lower, but maybe you're a female and you only weigh 100 pounds, I would be less worried about it, because smaller people have lower counts of things as a general rule of thumb. And if this is something that you can track historically, where your white counts have historically always been relatively on that low end, I'd worry less about it. Now, if this is something that's new, you have a history of, say, your white counts are 5 and now all of a sudden they're 3.5, and this is a new thing, now I would start looking at potential reasons why. There's a few things that kind of come to mind nutritionally with white counts being low. Probably the first thing that comes to mind is vitamin B12 deficiency. Vitamin B12 helps to stimulate bone marrow to properly produce white blood cells. So we see B12 deficiency very frequently cause low counts. Folate deficiency as well, vitamin B9, can also drive down your white count. So those would be two that I would look for. Another one would be L-glutamine. L-glutamine is the primary fuel source for your white cells. So just like most cells in your body use glucose as an energy substrate, your white cells use glutamine as their primary energy substrate. And we see a lot of people with low white counts have glutamine deficiency. As a general rule of thumb, clinically in my office, when people come see me, if we do lab testing and we get their white counts are coming back low and we can't run, there's certain types of tests that we run on the white cell, and those tests are non-viable, then we will actually give the B vitamins along with L-glutamine, and usually after a couple of weeks, we're going to see kind of some mild bumps, improvements in those white counts. So those are all possibilities. They're just easy access things that you can do right away. Let's see. Can you go up in the middle just a hair? Okay, so here we go. What would you determine when the inside of someone's lips have a stiffening sensation that leads to sore gums, swollen tongue, and feels raw, where they can't eat anything? I mean, it could be an infection. I at first thought I would say probably protein deficit. This person may be on a plant-based diet, not eating enough protein. Because of the need for collagen and the fast turnover of the buccal mucosa, the tissue inside of your mouth turns over every couple of days, and if you're protein malnourished, you're going to get swelling and soreness in the gums and even swelling on the tongue. So I would start there, but I would also look at just doing a full nutritional workup if that were me. That's what I would have done, just because the mouth and the oral cavity are so affected by many different things. B vitamins can affect it. Iron can affect it, certain amino acids. And so those are all possibilities. Would old silver mercury amalgam cause an allergic reaction or histamine intolerance? Possibly. I mean, it's hard to say for certain. If you're having a histaminic response, I would more suspect mold more than I would a silver amalgam. That's not to say an amalgam couldn't contribute to it, but histamine intolerance, development of histamine intolerance and histamine responses are generally, in my experience, a more infectious base. So there's usually a bacteria or a fungal overgrowth that's driving histamine reactivity. And oftentimes environmental mold exposure, especially if you're exposed to a kind of mold called fusarium, because a byproduct toxin of fusarium shifts your estrogen balance, and estrogen dominance causes histamine release. It actually causes your immune system to produce more mast cells and to make more histamine. So that's one of the reasons why I'm not a fan of this recent lifting of the black box warning on hormone replacement therapy. It's not to say that I don't think there aren't candidates for hormone replacement therapy, but one of the side effects of getting too much hormone estrogen is the driving of mast cell activation. And a lot of people don't realize that. And because that condition is becoming more and more prevalent, I think that should be something people should know. What can cause gum recession? Infection, nutrient deficiencies, predominantly like copper, vitamin C, very important for gum growth and gum turnover. And also protein, just as a whole. Can we do some swishing with glycine crystals and coconut oil for the mouth to encourage better mouth biome? I mean, glycine's not really going to probably do a heck of a lot directly to the microbiome. So I don't think that's. I mean, you can do that. I just don't think it's going to do much. I think the way you encourage a better microbiome in your mouth is to not eat processed food. Honestly, to eat very little to no sugar. When I say sugar, I mean processed sugar. That's one of the best things you can do, because what happens, and one of the biggest reasons why the microbiome of the mouth basically deviates into the direction of periodontal disease is refined food, ultra refined processed foods, especially refined sugars. It feeds the wrong microbes. And so when you feed the wrong microbes and it alters your microbiome, you change the nature of the chemical milieu of your mouth. And that is the best thing you can do versus, say, using something specifically to swish or wash your mouth with. Why did doctors and dentists discontinue use of gold? Because gold is a soft metal. I mean, it's a less reactive metal, but it is a softer metal and it doesn't hold up. And when one of the things, I mean, I don't fault dentists at all for, even for the use of silver, simply because what they're trying to do is put or create a filling that will last for a long period of time. It doesn't have to be refilled repetitively. And also there's, that part of what they're trying to do with those fillings is to get them to bond to the tooth effectively. And so, silver did that very, very well, which is why it was so widely used and adopted. Now, the mercury part of that's unfortunate. And, I'm glad to see dentistry as a whole is moving away from that. But gold is too soft of a material. So it doesn't withstand, the long-term wear and tear. What could cause low platelets? Same thing that can cause low white counts. Predominantly folate and vitamin B12 deficiencies are at the top of that list as far as nutrition is concerned. Are there tests for pathogens that may be at the root of different chronic issues? A test that looks at many of the common culprits? It depends. I mean, there are tests that look at a lot of different things, and then there are singular tests based on what a doctor might suspect. So, just say, for example, you were bitten by a tick, running a tick panel would be probably a top priority for a doctor to ascertain whether or not you have, a Lyme-based infectious microorganism versus, say, you've never been bitten by a tick, there's no history of that. That's probably not something he's going to really want to focus his attention on, but you may have a different kind of history where maybe you were, in the hospital recently for a colonoscopy, and you can ever since then you've had chronic diarrhea. So he suspects maybe you picked up a, hospital-acquired infection doing the procedure. And so now he's culturing your gut and looking for different kinds of bacteria, like C. diff and Klebsiella or Pseudomonas that could be potentially driving that type of problem. So there's not like one magic test that says we're going to look at everything and look for everything and this is it. It's usually a battery of different things, and that's why it's important that the doctor have a great knowledge and a background so that they can do that. I had 2 dentists tell me that I'm brushing too hard, told me stop using my electric toothbrush a few days of the week. I don't know. Did you ask them why they thought that? Did they see kind of abrasive marks on your enamel or enamel wear that's not typical for somebody your age? You might just inquire a little bit more deeply into the why they both mention that. Because brushing too hard can be a real thing. So if that's what they're seeing, if they're seeing physical signs of that, then yeah. But I would inquire a little bit more. An infected cracked tooth will be extracted. The eye near and around the tear duct has developed mild inflammation. Can maintaining ultra nutrients and vitamin C get me through? It's hard to say. If you're going to get it extracted soon, it just depends. It becomes a medical emergency when it does. So right now, it doesn't sound like it's maybe a medical emergency. But that, again, that's probably more a better question for your dentist to have them look at it and really see what that looks like. Because sometimes, waiting it out is fine. Your body has an immune system. It can combat and it can fight. So it's not a victim of everything in the environment, as far as that cracked tooth is concerned. But nobody can predict the future, including me. I have good teeth or great teeth and good oral health, but my gums always bleed when I floss. Is it metal allergy due to a metal bar? Could be a floss reactivity. What's your floss made out of? Are you using a synthetic floss that's made out of plastic fibers, or are you using, like a silk-based floss? It could be, it could be just the type of floss you're using in general. Some people also floss too aggressively. And as like with many things, there's an art to it. You can certainly injure a tooth by flossing too aggressively, and that could contribute to to gum tissue damage that lands on bleeding after the fact. So I would consider those 2 things first. If someone has the extensive decay or fillings, would it be better to go for root canal, caps, or implants or dentures? That's a good question for your dentist. Extensive decay. If it's extensive enough and the tooth can't be saved, and if it's decay, I'd certainly, personally, I'd tell you what I would do, Vicky, personally, is I would never do a root canal. That's just me personally. I would never do one. I don't want a dead tooth in my mouth. Dead teeth decay. It's just a matter of time. If it's already decayed and then you do a root canal and try to save a decayed tooth that you kill the root on, you've still got a rotten tooth in your mouth that can harbor bacterial microbes and other microbes that can lead to health problems. So in my opinion, I would never do a root canal for that reason. My opinion is if the tooth cannot be saved and the tooth is decayed bad enough or broken bad enough, then your next best step, again, in my opinion, is an implant. And so, not necessarily dentures. Dentures are, there's a whole thing with dentures and the effectiveness and how much they fall out and the chemical adhesives that you have to use on a regular basis to get them to stay in. So in my opinion, an implant, it would be the way to go. It's probably the most expensive of those routes, but it's actually more expensive to do a root canal. And then when the root canal fails, then you have to clean up the mess from that and fix that. And then an implant has to go in anyway. So I don't know if that answers your question. I'm not a dentist. Again, disclaimer there, talk to a dentist about that. But I would encourage you to talk to a biological dentist, because there are different treatment options in biological dentistry than in mainstream dentistry. And so they may be able to present you with something that could preserve what you have a little longer, a little better, without keeping a dead tooth in your mouth. Thoughts about removing decayed and cracked wisdom teeth. Again, it's a tough, I know you guys, a lot of you are asking me, and I'm trying to be as specific, but as non-specific as I can. It always boils down to the person and the situation. If it's a decayed, rotting tooth, get it out of your mouth. You don't want a rotten, decaying biological material, in your mouth, harboring, the potential for microbial growth to cause a problem. One of the things that we know with certain, especially with certain types of bacteria on decayed tooth material, is they can penetrate through into your bloodstream. The toxins from those bacteria can actually increase the potential risk of heart attacks and heart disease, among other things. It's not just a tooth problem. It becomes a systemic problem. So the answer about if you have a decayed tooth, get it out. That would be what I would do. Is a bridge an acceptable option for missing tooth versus an implant? It can be. A bridge can be a good option, a good viable option. Again, depending on, the health of the teeth around the bridge, and depending on the skill set of the dentist. Some are better than others. That's no doubt. I've seen people that do bridges where they were installed and, the angle was wrong. And so the bridge became basically under enough pressure, it just failed multiple times. And I've seen cases where bridges were installed and they were done really, really well and lasted a really, really long time. So bottom line is get with a dentist with a great reputation and get an opinion on what they think, because part of the success of a bridge is the health of the teeth that you're gonna put the bridge on. Let's see. If someone chewed tobacco and did damage to the gums and teeth, how would you try to heal the damage after the chewing tobacco had been stopped? I mean, it's already going to start healing just by the removal of the toxin of the tobacco. So that being said, obviously good oral hygiene. I would do nutritional testing. A lot of times with tobacco, chronic tobacco use, what do we see? We see antioxidant dysfunction. We see vitamin C deficiencies. And so those are just top of the line nutrients that come to mind first. So I'd probably start there. Could you do a video showing us how to do fascial stretching and stretching different parts of our body? Yeah, I think we're going to do something like that this summer. I've been saying that, but I think I'm going to set aside some time this summer to do a whole exercise stretching series for those of you interested. As a matter of fact, how many of you would like to see that? Just comment below if that's something that you'd like to see, because I don't want to spend hours and hours and hours putting together a library if it's not something that you guys really want from me. Oh, let's see. Go up just a hair. A little more, a little more. Keep going. So, okay, here it is. I use a toothpaste with hydroxyapatite to remineralize teeth, and hearing that if glycerin is also present, then it keeps hydroxyapatite from providing remineralization. I don't know that I would agree with that statement. Go up a little bit more. Which could be better for mild circulation in the hands and feet during cold weather, citrulline or arginine? I'd say it depends. Citrulline's a good option because it can increase nitric oxide and vascular flow. If you have a chronicity toward fever blisters or cold sores, then arginine would not be the choice because arginine can exacerbate that due to its direct inhibition of lysine. So citrulline in that situation would be the better choice. But it may not be that either one works really well because, you know, that circulation in your hands and feet might not be a citrulline or arginine issue. It might not be a nitric oxide issue. It might be something else entirely that just showing up in the winter because of the temperature change, but it's actually there in the summer. But the heat of the weather, you know, prevents you from recognizing symptomatically what's happening. So I would look at other things that are important for vascular flow and function. You know, an example would be omega-3, magnesium, which keep the blood viscosity thin. You might ask your doctor to run D-dimer and fibrinogen tests and prothrombin tests to determine whether or not your blood viscosity is too thick, and that might be the culprit. And then that cold is just exacerbating it enough for it to show up in the winter months. But those would be all things I would consider. Okay, let's go back down. Okay, lots of yeses. Info on vibration plates, machines. We just got one and my leg circulation was much better last night. So vibration, I really like vibration in people that have been sedentary and they're overweight and we're trying to introduce exercise in a manner they can tolerate it before they lose the weight. A vibration works really, really well. I also really like vibration plates for stretching. Because it's the oscillation, the vibration that allows for a deeper and more profound and more effective stretch. So one of my favorite things to do, I have a vibration plate. Pre-warm up is to stretch out my hamstrings and my quads on my plate so that I get more effect out of my stretch. I also like to stretch my shoulders and back on the plate itself. Is it okay that calcium fluoride be used in toothpaste unlike sodium fluoride, or are they both bad? I wouldn't put fluoride in me. So I would avoid them both. Are the vibration machines more hype or not? It depends. I mean, there's certainly use cases for vibration plates. I think they're overpriced. But I think it also depends on the person. I mean, if you're 250 pounds and that's 100 more pounds than what you should be, and your knees hurt too bad to go for, you know, extensive walks, or your other joints are problematic because of that extra weight, vibration is a really great intro to starting with movement. So in that regard, they're fantastic. But if you're, you know, already physically fit, do you justify the expense of, you know, several $1,000s or several $100s, depending on the unit you're looking at buying, you know, for one of these machines? It wouldn't be something I would put at the top of the list of machines that I would say are a priority. To me, what is the priority if we're talking about physical activity is your body weight. It's number one priority. Learn how to master control of your own weight. Push-ups, sit-ups, squats, lunges, jumping jacks, jump ropes, plank holds. These are all great things that are just body weight, that require no equipment. They don't require, ladies, that you put on makeup to go to the gym. They don't require that you take the time to drive to a gym. You know, when the weather's bad, you can do these things in your living room floor, and you can do them relatively quickly. And if you do them safely without risk of injury, and you can benefit tremendously. So, you know, a lot of people, how do I want to say this? There's a lot of machines and there's a lot of machines that offer benefit. I personally love CrossFitting, but I also love going to the regular gym with machine weights and free weights. I like to lift weights. I just always have, and I enjoy it. So it's something for me that I enjoy. But there are a lot of people that don't like those things, and so they're just looking for a viable option to keep them physically fit, to spend as little amount of time doing those kinds of things as possible because they don't enjoy it. Calisthenics, 4-minute calisthenics. If you followed me for a while, you've heard me maybe talk about Tabata. I have an entire video on just the power of exercise and the biology of exercise as its impacts and effects on health. It's called Muscle versus Medicine. If you haven't checked that video out, go check that one out, because it'll give you the ins and outs of why it's important. But we don't really talk about what to do. But Tabata is just a 4-minute routine, and it's very, very simple to do. And you can pick any type of calisthenic, and you can perform a 4-minute routine. If you're out of shape, it will challenge you. And if you're in shape, it will challenge you. It doesn't require equipment, and it doesn't require that you leave your house, and it doesn't require a lot of time. So now you're out of excuses. So anyway, I think the response overwhelmingly has been that you guys would like to see some exercise stuff from me. So we'll put that together for you. When I used natural toothpaste, my teeth bled, stopped when I went back to fluoride toothpaste. So it's not the fluoride, most likely. You're probably reacting to something in the toothpaste that was natural. There are ingredients in natural toothpaste that can also create reactions. I've seen it go both ways. I've had people, same thing, where they're using a toothpaste, and we do food sensitivity and additive sensitivity testing on them. And what do we find? We find they're actually reacting to the ingredients in the product. And when we stop the product, not necessarily put them on fluoride per se, but stop the product for a different one, we find the gums stop bleeding. So it might not be that you need fluoride. It might simply be that your natural toothpaste had ingredients you were reactive to. Do vibration plates help with lymphedema? Yes, they can. I like that. So I wanted to share that the first part of my body that showed improvement after correcting deficiencies is my teeth and gums. Love it. Remember, your mouth, very fast turnover, 2 to 7 days, the lining is brand new. So generally it is one of the areas that we see improve quickest. Somebody said, ooh, put on makeup to go to the gym. You'd be surprised. Most of the, in the gym, at least that I go to, most of the time, that's what we see. So, okay, so this one on oral health for celiacs. What can celiac patients use? You can use toothpaste. You just have to make sure it doesn't contain, grain-based fillers. And there are options out there for sure. Do parasites have any role in oral health issues, including decay and gum disease? They can. Less common than what a lot of internet people are saying. I think a lot of people online that pump up parasites are trying to sell parasite this and parasite that kits to everyone. That's not to say parasites don't exist or can't. They certainly do and can, but I think they're overstated. Vibration plate recommended for the EDS pot stuff, in addition to all the exercises mentioned earlier. Let's see. I'd love to see a class on fascial stretching. Okay. I think. So one of the things I did want to talk about today is the holidays. So here we are. We're in the beginning of December. And what ultimately is happening for a lot of people right now is holiday parties, Christmas parties. So you're, not to say that all of you are, but many of you are eating out. You're eating at other people's homes. You're eating other people's food. Maybe you're drinking alcohol in celebration. Many do. And so what's happening right now, what we're seeing in our clinic is an influx of people with colds, flus coming down, is sick or ill. Because why? Because they're eating food they don't typically eat. They're drinking alcohol they might not typically drink. Their exercise is taking a back door. There's less daylight hours, so they're getting less sunshine. And so there's immune benefits to sunshine. And on top of that, when they're eating everyone else's food, they're being exposed to potential cross-contamination of gluten, among just other unhealthy things about processed foods, that are commonly served at these types of events. So kind of a precautionary warning to any of you, if you're going out and you're being social in that way, there's 3 things I would encourage all of you to do in terms of supplement priority right now. One would be making sure you're staying on a good quality multivitamin. That's kind of like the shotgun, right? Where you have multiple nutrients coming in consistently day in and day out to support your body during this time. The second is gluten shield, or an enzyme comparable, which will help you digest or break down any kind of cross-contamination or accidental exposure that you might get if you are going around eating other people's food. And then the third is immune support, because right now, as everybody's getting together and doing bad things, they're detrimental to their immune systems. They're now becoming more predisposed to colds and flus and other things. So, love your immune system. Consider Virid. Virid is a formula that contains vitamin C and vitamin A and zinc and andrographis and elderberry, other nutrients that are designed to support the immune system and just kind of keep you floating through this time, and hopefully prevent you from coming down with something. Because the other thing you got to worry about is the shedding that's happening right now, because the people that aren't like you are running over to that other kind of doctor, and they're doing that thing that creates that shedding that then disperses and affects us all. So you have to keep all of those things in mind and protect yourself. Now, as a fourth runner-up, so I said multivitamin, I said gluten shield, and I said Virid. And as a fourth runner-up, this is especially true if you live in northern climates where there's not a lot of sunlight, consider vitamin D, high-dose vitamin D therapy. That's what we call STOS therapy. It's the 3 days of vitamin D therapy at 150,000 units a day for 3 days, to get your levels of vitamin D up. And remember, it's an immunoregulatory nutrient, so it can be very, very effective at helping prevent colds and flus, and supporting your immune system through this time. So those things are things I'm currently doing right now, just as prophylactic. Not that I go and eat other people's food. I think you guys know my attitude on that. But as a general rule, I do sometimes imbibe in alcohol, and so I want to keep my immune system the best that it can be during this time. So, with all of that being said, take care of yourselves. This is the time of year that a lot of this. Here's what we see clinically is that people do more damage to their health at the last week of November through January 1 than at any other time of the year. Because what they're telling themselves is, I'm going to let it all go and enjoy the season to the detriment of myself. And then on the new year, I'm going to make a resolution and I'm going to dial it all back in. And so you have to understand that that's 6 weeks. That's 10% of your year. And if you're talking in just math terms, it's actually a little bit more than 10% of your year. Your grade just went from an A to a B really, really fast by giving yourself permission to do self-detriment for 6 weeks straight. So, keep that in mind. Take care of yourself. Keep your exercise program going. When the sunlight is out there, get out as much as you can. Go to bed on time. Get through the season maintaining your health, being a shining beacon, being a good example for other people who maybe are doing it wrong. And let's create a culture of health and a culture of health awareness, as opposed to a reactionary culture that every January 1 says, I'm now going to quit hurting myself on purpose, and I'm going to focus at least the month of January on a new resolution that probably fizzles out in less than 2 weeks, because that's just the true reality. So stay focused. It's an easy time of the year to lose that focus. So stay on target. Dosing for Virid, Ange, is 4 capsules a day if we're trying to be a little more aggressive, 2 caps a day if you're just trying to be just general preventative. Should enzymes be taken to help the shedding? Can be. So enzymes are great as binders, but I'm more favorable of NAC for that, for shedding. So N-acetylcysteine is my favorite for that. Somebody's asking about essential oils. Oil of oregano. There's a lot of quality brands. I would certainly make sure it's an organic version versus a non-organic. Okay, I think I've covered most of everything here. So yeah, that's a wrap today, folks. I'm going to go and work on some exercise and fascial stuff for you guys. It seems like everybody wants some of that. So thank you so much for tuning in. I hope you had a wonderful Thanksgiving. If you are new, make sure you know to come visit us over at glutenfreesociety.org. If you sign up there for our newsletter, I'll send you a bunch of free information on nutrition. I'll send you a bunch of information on how to navigate your diet and lifestyle to overcome autoimmunity. So if you're struggling and you're really trying to figure it out, that's where we live. That's our hub. So make sure that you're on our list over there. And like I said, we'll get you a bunch of great resources. Make sure too, you tune in next Tuesday. We'll be back on Tuesday for I've got a really special interview coming up this Tuesday on infertility that you guys are going to want to check out, especially if you know somebody who's trying to have children. So tune in on Tuesday at 6 p.m. for that masterclass. And I'll be back on Thursday for another live Q&A. So bookmark your calendars. That'll be 12:30 p.m. Central Standard Time. So those of you who are new, make sure we've got 2,000 videos in our archives, more than 2,000. And so if you want to do deep dives on nutrition and health, this is the library place to come, where you've got access to more information on this topic from one of the world's leading authorities on this topic, 100% free to access. So make sure you check out that free resource, and we'll see you next week. Take care.